But I think because at the time I started, which is over 30 years ago, hematological neoplasms were still a black box with many things to understand about what was happening in the beginning of the neoplasia, in the transformation, in the behavior after therapy. And it was probably the type of tumor where there was the greatest probability of advancing sooner, basically because of their presence in easily accessible samples like blood or even bone marrow. And on the second part, because of all the knowledge we had about the normal hematopoiesis and the normal hematopoietic cells. So probably that was the major reason to focus on that, a big part of our work. So at present, I think the big challenge is how to make minimal residual disease monitoring going into blood. So trying to do it without having to go to a bone marrow or to other tissues, and just being able to do it in a very high sensitive way in blood. I think we are almost there, so it's becoming, I would say, feasible in the clinics, and this will be a big advantage for the patients because in fact you don't need a bone marrow, you get a much less invasive procedure. And finally, you can monitor more frequently. So at any time point you would like, you can in fact tell how the disease is behaving. Well, I think the first thing is that they choose to work in something they really like. Because working in something you like always gives you, let's say, a double energy for the same effort. So if you do your work with pleasure, then your work is much more rewarding. And the second message would be that they should select probably a topic to start where they think there is something that you have no answer to explain. And the more you know about a specific topic, the more you understand how less we know about everything. So there is always many questions where research can focus and where you can contribute. The advice in this area would be to pay attention to things and to always ask why, and then try to answer. Well, we have contributed in several areas, which might appear to be minor, but are multiple. So we were the first to describe, for instance, a tumor of plasmacytoid dendritic cells. Even before, or almost at the same time, that the normal plasmacytoid cells were described. That came in a paper published in Annals of Internal Medicine. And that was a diagnosis that the clinicians that had to treat the patient were very surprised in saying, how shall we treat? Because this is not part of the current classification of leukemia and lymphoma. We were also the first group to show that CD4 large granulocyte lymphocyte leukemias were, or on their ontogeny, there is cytomegalovirus. So that these cells, in almost every patient, they are specific of CMV. Even if they have mutations in STAT5 or STAT3, the receptor identifies proteins of CMV in specific HLAs. So we show the genetic predisposition, HLA, and an environmental factor, CNV, and a genetic trigger like a STAT5. More recently, just picking some examples, more recently, for instance, we have contributed a lot in monoclonal B-cell lymphocytosis. So we just showed that this is as frequent as probably 100% of adults over 70 years. So this would be even considered as normal. Also, we showed more recently that in the midterm, like in 5-10 years, it does not transform to a leukemia, but the cells grow, the cells acquire genetic abnormalities, so the cells become more similar to the leukemia, but at the same time, they create a health problem. They create an immunodeficiency, a secondary immunodeficiency that makes many patients dying because of respiratory infections. It's not patients, it's healthy individuals. So in other words, it appears that MBL for health populations might be as relevant as cardiovascular diseases or cancer, the major causes of death, because in this group of individuals represents more than 20% of the deaths. And for sure, from a practical perspective also, I think that what we have developed in the last 15 years, all the tools for diagnosis of leukemia lymphoma, of primary immunodeficiency, of immune monitoring through the Euroflow consortium, I think these have had really a practical interest worldwide.